So welcome to HiNZ 2018, and I'm here with Chris Rumball. And Chris, congratulations on being the winner of NZ Hit Innovation Award.
Thank you very much.
For your Sense Medical Cortex
Yes.
application. Tell us about it, Chris.
So Cortex is the result of a quite a long-standing collaboration between CDHB and Sense Medical. And it's a platform that's developed over probably 5 or 6 years with applications that are there to enhance really multidisciplinary team coordination and care. And so it's got a number of components to it for that, which include patient lists, integration and access to clinical information point of care, idea of a circle of care, so who's involved looking after the patient, and electronic orders, and then more recently really developing electronic clinical documentation at point of care. So how do we do that on an iPad? And it's worked very well because bringing the team together on a single platform, it's visibility, it's communication, and it's had some really great results at CHB in improving patient care and particularly shortening length of stay and reducing bed nights. And so that was all done in the general surgical department at CDHB. And with that success, it's now moving on to being deployed in a number of other departments, and as they move into their new buildings. So it's a very exciting one, and look, it's a great validation, I think, for what we've been working hard at for a long time now.
I should mention, actually, as clinical lead for Sense Medical as a practicing clinician in pain management, that's your specialty. Were you able to bring some of that into the design of the application? Is there a connection there?
Yeah, there is actually. I don't use it in my own clinical practice yet because it's based in the community, but the strong link is really the importance of the multidisciplinary team. Pain management is very much an area where you need to coordinate a set of skills that no one person has. So you have psychology input, often physiotherapy, occupational therapy input, and medical. And we have significant challenges in it, in how you coordinate that. And we've learned a lot in Cortex at the hospital, the importance of having all of those different disciplines involved in the design and development. So look, it's been a huge learning in the importance of just simple things like having team members on the same platform, with seeing each other's notes, seeing what each other are doing, just to avoid the kind of siloed care, which has been, I guess, one of the real challenges of healthcare, particularly in hospitals, and it's still the case in the community. Yeah, so it has crossed over a lot. I'm looking forward to the next couple of years when I'll aim to be sort of using it in my own sort of practice, and particularly in the community, because I think there's huge problems to be solved and huge opportunity for improved patient care.
Is it far enough along yet that you've actually seen or gotten the reaction from the patients themselves who are benefiting from it, or do they just get the outcome of it? They don't actually see the platform or the reason?
I think it's an interesting question. I think they don't see it as Cortex. They've had the benefits that we've measured, which is improved, sort of reduced length of stay, so shorter stays, particularly for non-elective admissions. I guess was one of the interesting outcomes. So the benefit, and so shortening hospital stay, it's lots of benefits, decreased infections, for example. I think the other part of that is what they see are clinicians with tablets and phones around them. That's quite a big change. It's come on over the past few years. I think we need to be quite wary of that, what patients think when they see that, particularly if they see people doing it on their phones, because you might just assume that they're checking the news or tweeting or something. But I think because the clinicians are so good, and clinicians in public hospitals, and particularly at Christchurch and all through New Zealand, they're all very good people, and there's always a good trust, I think, in places like that. So it hasn't had, I think, or engendered the concern that could have come when you see people with tablets in front of you doing things. Yeah.
It sounds really good, Chris, and congratulations again. And come back and tell us when you start using it in your own practice.
Yeah, I'd like to be back here presenting some of my own data in the future. So it's got a long way to evolve. It's very exciting. Thank you very much.
That's really good. Thanks so much for coming along.
You're welcome. Thank you for having me.
Thank you.